Hey everybody, welcome back to Sip and Share with me, the Sweet Physique. So, before we jump into anything, I just kind of want to hit you guys with this scenario. So, imagine being in the hospital. Maybe you're the pregnant woman that's there, or maybe you're a family member there to support, your wife, your mother, whatever the familiar relationship is, but you're in the hospital. You have just been diagnosed with preeclampsia. So your head is spinning. You've been told all this information at one time. You feel like they're kind of dumping a lot on you at once. It's just so much going on. Due to the nature of your preeclampsia, it's super severe. Blood pressures are high. Doctors are running in and out your room, getting you to sign forms for emergency viz. Maybe you need to receive blood for that. Like, there's just a lot going on. The NICU team has come in and explained to you, like, hey, if in some case there's early delivery, then we need to discuss X, Y, and Z for you to be prepared for the NICU journey. You're just like, whoa, wait a minute, guys, what's going on? Doctors have told you that you're there for observation indefinitely, so you don't even have a discharge date to kind of like count down to. You're just kind of there, like biding your time. They've drawn blood, stuck you so many times, like you're bruised. It's just a very uncomfortable situation. And of course, as the mother and as family, the fear and the uneasiness is heightened because it's like, with all this going on, how's my baby? We haven't had an ultrasound done in X amount of time. Is my baby okay? What are the next steps to make sure that we both are okay? What is going on? All that's happened. Doctors come back in the room after a bit of time and say, hey, this is what's going on. Your blood was ran and we saw some very concerning results. Your liver value levels are heightened and you're going into liver failure. Your platelet counts have dropped so low that you're at great risk for internal bleeding, and if for some reason we have to take you to surgery, you're at risk for possibly bleeding out on the table. And honestly speaking, the only way to give you and your baby the best outcome is your baby has to be delivered now. That's the scenario. Definitely a lot going on, but welcome to HELLP syndrome. So, what is HELLP syndrome? What does it mean? What does it stand for? How do you even spell it? So, HELLP syndrome is an acronym. HELLP. So, here is the breakdown of this acronym. The first H is for hemolysis. So, I'm pretty sure all of you guys have gotten your blood drawn at some point in your life, whether it's a hospital visit, a routine doctor's visit, something. So, they put the butterfly needle in your vein. They draw your blood. It's going down the little tube into the vials, which are those clear cylinder devices with different colored tops on them. They collect your blood. They either send it to the lab in the hospital or they run it outpatient for you. Now, this is seen quite frequently in the hospital in real time, but say you just got your blood drawn, you're chilling, watching TV, need some snacks. The nurse comes back in or the phlebotomist comes back in and say, hey, gotta get more blood. And you're like, well, buddy, time out. You just stuck me. You're not sticking me again. Why do you need more blood? And they tell you it was a bad sample, or they may even say your blood hemolyzed. So when your blood hemolyzes, the red blood cells that have been collected have burst, and we're not able to run that sample because at this point now it's not usable. It is a bad sample. It's not in the state that it needs to be in. So hemolysis, or being hemolyzed. So when your blood is hemolyzed, the cells are bursting. So that's a problem. And the main reason why that's a problem is if you think way back when to science classes back in the day, a primary function of the red blood cells is to carry oxygen throughout the body via your bloodstream. So if your blood cells are hemolyzing and not functioning properly, guess what? That oxygen isn't being delivered to the extremities, to your brain, like it's supposed to. So not enough oxygen to the brain, we already know is damaging. Not enough oxygen to the extremities is damaging. So hey, we gotta stop the hemolysis of these blood cells because we need oxygen to get to where it needs to be. Hemolysis. The EL stands for elevated liver enzymes. So, with that being said, your liver count is high. So the lab values that we look at to determine if your liver value or the functionality of your liver is in range, that value that we're looking at is above the markers. So with that being said, if your liver enzyme level is high, then you are at risk for liver damage permanently. You are going into early liver failure. There's something not quite right with your liver and the balance of what's going on with these enzymes is throwing everything off. And when you see people with liver damage, liver failure at later stages, you see the jaundice, which is like yellowing skin, yellowing eyes. So it's like we need to reverse those lab values to get you back on track with where you're supposed to be with that range. So elevated liver enzymes, not good. Then the LP stands for low platelets. So I'm pretty sure all of you guys have heard of a transfusion. You can get a blood transfusion, red blood cells. You can get a platelet transfusion. There's a lot of different transfusions you can get. And yes, if your platelet counts are low, there's always a conversation of a platelet transfusion. However, that's not fixing the problem permanently. It's kind of like a band-aid to the issue. And in this case, we don't want to put a band-aid on the issue. We want to actually just fix the problem because low platelets, once again, not good. You're at risk for internal bleeding. You can bleed from crevices like your nose, your rectum, your gums. There's just a lot of places you can bleed from this. You're going to be like, I don't want to bleed from there. And if you were to have any sort of surgery, you're at risk for bleeding out because it's easier for you to bleed than a person that doesn't have low platelet count issues. So once again, LP, low platelets, we do not want. And then imagine having a combination of all this going on in your body. Your body's just in overdrive right now. So HELLP syndrome, in a nutshell, is not where we want to be. We don't want to hear those words. We don't want to see that acronym. We don't want to be associated with it because it's very, very, very dangerous. I want to throw a few stats at you guys. So according to the Preeclampsia Foundation, of all of the pregnant women that have been diagnosed with preeclampsia, around 15% of those women end up developing HELLP syndrome subsequently. So this equates to about 45,000 women that end up developing this diagnosis. It's a lot of women. So, of course, we want to prepare you for the signs and symptoms to look out for. So, there is abdominal pain, and then there is chest pain, kind of like epigastric or indigestion type of pain. Then there's nausea and vomiting. And then there's pain, mainly after you have finished eating your food that you can develop. You can develop shortness of breath, and then sometimes It's painful when you take a breath in or you inhale. And then sometimes you can get visual changes. So double vision, blurry vision, sometimes painful vision when trying to focus in on something. Of course, there's the infamous headache that you can develop that just won't go away even once you properly medicate yourself. And then last but not least, swelling of the hands and or the feet. Those are all signs and symptoms to look out for. Yes, some of those signs and symptoms overlap with other diagnoses. So it's just the bottom line is just tell your physician, healthcare team, nurse, tech, whoever, tell them immediately when you get these abnormal symptoms, like, hey, this isn't right, XYZ is going on with me, blah, 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 get it on record so that we as healthcare providers can move accordingly. Okay, so when you get diagnosed with HELLP syndrome, the biggest question is, what's going on with my baby? Are they okay? How does this affect my baby? Like, what is the treatment? Like, what are you guys doing to help me and my baby? I haven't had an ultrasound in a minute. So are they good? What is going on? So, once again, this is something that nobody ever wants to hear, especially depending on how far along you are in your pregnancy. But it's something, but especially if it's earlier on, unfortunately, at this point, once you've developed HELLP syndrome, typically, the best option to give you and your baby the best chance at life is early delivery. There's not really a lot of other things to talk about because at this point, HELLP syndrome is so serious. Like I said earlier, this is not a band-aid moment. There's nothing to put a band-aid on your cells bursting and you're not able to oxygenate your body. There's not really much of a band-aid to put on early liver failure other than reverse what's going on. And to reverse it, you have to get rid of the problem internally, which is the fetus and the placenta. And like I said, with the low platelets, yes, there's transfusions, but that's a band-aid. It's not actually fixing the root cause of the problem of what's causing your body to have low platelet counts. And as scary as that is, sometimes that's really, or a lot of the time, it's really what it comes down to, early delivery. And I would know things change that drastically with HELLP syndrome. So once you've been diagnosed with preeclampsia, they're already looking at you with a microscope because they know, labor and delivery doctors and nurses, the care team, they just know that once preeclampsia has been confirmed, you can get sick so fast, especially depending on how high your pressures are. If your pressures are through the roof, they're medicating you, but it's not really kicking in how they want to manage things, it's not a good sign. And the reason why a lot of times they want to observe you indefinitely is once again to reinforce the fact of you can get sick so fast and things can go left so fast. And once again, I can attest to that. I came in noontime on one day. They were trying to manage my blood pressures, drew labs, got a baseline value of everything. My labs were fine. And then 6 a.m. the next morning, doctors like rush into my room like, yo, you've taken a turn for the worse. You're going into early liver failure, so my liver enzymes are up. Your platelet counts have dropped significantly. They're low. I'm at risk for internal bleeding and external bleeding, even with a C-section. So, you know, they knew that. And it may be a lot, but when you're admitted with preeclampsia, especially depending on how high your pressures are, and doctors are rushing into your room, you know, sign this form, giving us permission for a blood transfusion. Sign this form giving us permission for an emergency C-section. The NICU team comes in and wants to talk to you about the NICU journey in the event of, you're like, yo, I'm just here for high blood pressures. Like, I don't need all of this. But you do. Because like I said, you can get sick that fast and they don't have time to play with you. Once you're that sick, the baby needs to come out within hours. From the time I got the news into me being on the OR table, it was under 2 hours. Like, it was business. And as scary as that was the best outcome for me and my baby to survive. Another thing that's something that they look into when you're in this preeclampsia phase and they know that it could potentially turn into something serious very fast is the fetal lung development. So there's a shot, well, you get multiple shots, but what the mother gets, this shot called surfactant. That shot is given to help develop fetal lung capabilities. So I want to say it's 2 that you get, but you get those scheduled in to the routine care during your pregnancy. So I had already had one at a routine OB visit. Thank God. Got admitted. Wasn't quite time for the second one, but due to the nature of the circumstances of what was going on with me, I got the second shot. Just in case things went left, my baby would be exposed to some of that second shot with her lungs. And thank God that they did, because literally less than 24 hours later, I was looking at my baby. So they know what they're doing. It's definitely a whirlwind of information. I wish there was some way to make it more concise, bring it down to a level of understanding that would be a little bit easier to take in. But it's like you're pressed for time at that point and they have to go over everything and it's a lot. But that's why I'm doing this. It's hopefully exposing you guys to what these things are. God forbid that this is ever your scenario, but in the event that it is, when doctors rush into your room, you're already mentally like, okay, this may not look good for me at some point, but this is why they're doing it. You know what HELLP syndrome is now. So I just want you guys to feel a little bit more prepared for the unknowns that can happen with pregnancy, because honestly speaking, you could be walking around feeling fine and then snap of a finger, blink of an eye, you're a patient because something has gone awry. So thank you guys for tuning in. Definitely more content dropping soon. Love y'all.